first, we go to KEZI 9 News reporter Jillian Smuckler, who is live in the studio to explain the pause on statewide reopenings and how it impacts our area. Jillian?
Renee, the news came to a shock to many counties who were eagerly waiting to take that next step towards normalcy after months of being shut down. But it's important to remember that back when Brown's reopening plan was first laid out, she said if there was any spike in cases that caused concern, they would reassess. And that's exactly what they're doing. I sat down with Senior Health Public Officer Patrick Ludke to talk about the recent spike in cases and what this means for Lane County.
What would it take to go backwards? How bad would it have to be?
It's the question that's on everyone's mind. He says so far, Lane County's been really lucky.
We didn't have a first peak. We prevented a peak. We turned it into a plateau by all the efforts that the community did and our clinical enterprises did.
But he tells me if we had a terrible surge, we would have to adjust and possibly take a step back, something he doesn't think will happen.
I don't anticipate we're going to have something big like that this summer. It could happen, but I don't think so. I think if the biggest risk is going to be in the late fall.
He said a potential second wave is what health officials are worried about.
We need to really take advantage of that gift of time.
But he says our increased testing is what's keeping our numbers and hospitalizations so low.
If we had a big outbreak at a jail, at the Eugene Mission, at a long-term care facility, we can get a sense of what's happening on the ground in just a few hours now.
He says even though we're expected to stay in phase 2 for a few months, people cannot let up.
Over the course of this pandemic, maybe about 2 years, 60% of us will get infected. So that's a little frightening, but 80% of those infections are either asymptomatic or mild. So that's kind of comforting. But the other 20%, those people can get pretty severe disease.
Oregon Health Authority released new models that say worst case scenario, Oregon could see 1,040 cases per day by July 3rd, which is why Ludke agrees with Brown's decision to put reopening on pause.
Do you think the 7-day waiting period she has for these applications is going to be enough then?
Yeah, I wish I knew. I wish I was more of an expert. I'm not convinced there's any expert right now in this area. 7 days is probably the smallest I would ever consider. I just don't think you get enough data points to say, wow, this is happening, this is happening.
He suggests at least a few weeks before moving forward.
Renee, Ludke says if we got a widely available vaccine by December, which he doesn't think would happen, but even if we did, you may need to get a booster dose in March, April, or May. So it's a long time before you can get immunity to the virus. He says 90+% of people in Lane County are still susceptible. That's why it's crucial that we don't let our guards down no matter how long we're in phase 2. Washing your hands, wearing face masks, and social distancing are more important than ever before. Reporting live in the studio, Jillian Smuckler, KEZI 9 News.